Welcome back to the Deep Dive. Today we are digging into a stack of documents that, frankly, it reads like a masterclass in problem solving. We've got case studies, some financial reports, and a few really compelling articles about a company called Sehat Kahani.
It is a fascinating story, and what I love about this one is that it isn't just about a startup making money. It's about, a startup trying to fix a broken societal equation.
Exactly. It feels like we're looking at a puzzle where the pieces have been sitting on the table for years, but nobody thought to put them together until now. And the best place to start is with what I'm calling the paradox. I was looking at the medical education data from Pakistan in our source material, and the numbers are just baffling.
Baffling is exactly the right word. It really defies standard economic logic.
So let's lay it out. Pakistan produces a massive number of medical graduates every single year. It's a very competitive field. And get this, roughly 70% of those medical students are women.
7-0. It's a huge majority.
It is. I mean, in many parts of the world, getting gender parity in STEM or medicine is a struggle. But here, women are absolutely dominating the academic side.
But, and this is where the math just stops making sense, the majority of those women never actually practice medicine. The statistic in the report says roughly 50% of female medical graduates drop out of the workforce entirely.
So they spend years in grueling study, they graduate, and then they stop.
That's the core of the issue, and to understand why that happens, you have to look beyond the economics and into the culture. The sources refer to this as the Dr. Bride phenomenon.
A Dr. Bride.
Yeah.
I have to admit, when I first saw that term in the notes, it sounded like the title of a rom-com or something.
But the reality is much more complex, isn't it?
Far more complex. In this specific sociocultural context, a medical degree is extremely prestigious. It's a status symbol. It signals intelligence, dedication. Class, exactly.
Yeah.
So families often encourage their daughters to get into med school, not necessarily for the career, but because it makes them a high-value match for marriage. So the degree becomes a kind of dowry enhancement.
In a way, yes. They study hard, they graduate, they get the title doctor. But once the marriage happens, the dynamic just flips. The expectation from in-laws, from husbands, or just general societal pressure is that their priority has to shift to the home.
It is such a heavy pivot. You go from saving lives to managing a household, and the career just evaporates.
And it creates the situation where you have thousands of qualified female doctors just sitting at home, their skills effectively dormant.
Which brings us to the second half of this paradox. While all these doctors are sitting at home, you have millions of people, specifically in rural Pakistan, who have absolutely zero access to healthcare.
It's a supply and demand failure of massive proportions. You have the supply, these female doctors, and you have the demand underserved patients. And you have to be specific about that demand side, too.
Right.
In many conservative rural areas, female patients are often not allowed or just deeply uncomfortable seeing male doctors.
So if there's no female doctor available in the village, those women just don't go to the doctor at all.
Exactly. They suffer in silence, or they rely on untrained midwives or healers. So you have patients who need female doctors, and you have female doctors who aren't working. The two groups are completely disconnected.
It seems like the solution should be obvious, right?
Yeah.
Just connect them. But if it were that easy, someone would have done it decades ago. And that's where Sehat Kahani comes in.
The name literally translates to story of health.
And their mission was to solve that exact equation, to use technology to connect those home-based female doctors with the patients who desperately need them.
Now, the origin story here is really worth unpacking because the founders didn't just observe this problem from some ivory tower. They lived it.
They absolutely did. We're talking about Dr. Sara, Saeed, Khurram, and Dr. Iffat Zafar Aga.
The details on Dr. Khurram were particularly striking to me. She was actually terminated from her medical residency when she became pregnant.
Can you imagine? It just highlights how rigid the traditional system was. It wasn't built to accommodate mothers.
Not at all. And Dr. Zafar had a similar experience. She had to quit a corporate job because the hours were just too inflexible for a new mother.
That's wild. They were high achievers who were basically pushed out. They were almost statistics themselves.
They were. They were almost those Dr. Brides who left the workforce permanently.
But instead of accepting that, they decided to change the system. They launched Sehat Kahani in 2017. Now, it's important to note this wasn't a completely cold start.
Right. It was a spin-off from an earlier project called doctHERs.
So they had a bit of a head start.
A bit. They inherited a small network, about 14 clinics and 500 doctors, but their goal was to take that foundation and truly democratize healthcare.
I love that phrase, democratize healthcare. But let's get into the nuts and bolts of how this actually works. Because when I think telemedicine, I think of me in my apartment with high-speed Wi-Fi, FaceTiming a doctor. But we're talking about rural villages in Pakistan. These are places that might not be tech-savvy, they might not have great internet. How does a villager in a remote area FaceTime a doctor?
That's the brilliant part. They realized they couldn't just launch an app and hope for the best. If they'd done that, it would have failed immediately in these communities.
Right.
They developed what the case study calls the clinic-to-cloud model, or as we like to call it, a phygital model.
Phygital. Physical plus digital. I like it.
Exactly. They established e-health clinics right in the heart of these low-income communities. These aren't virtual spaces. They are physical brick-and-mortar clinics.
So when a patient walks in, they're not just staring at a computer screen.
No, they're greeted by a human being, a nurse, or a lady health worker.
Okay, I want to pause on that because the human element seems crucial here. This nurse isn't just a receptionist.
Not at all. She is the linchpin of the whole operation. This nurse, she acts as the intermediary. She checks the vitals, blood pressure, temperature, heart rate. She takes the patient's history. And then she's the one who handles the tech.
So for the patient who might be elderly or illiterate or just tech-phobic, they don't have to touch the technology at all.
Not at all. The nurse becomes the remote doctor's hands on the ground. The doctor appears on a video screen. She's sitting at home, maybe in Karachi or Lahore, but the nurse is there to physically examine the patient under the doctor's guidance.
That bridges the trust gap beautifully. You're not trusting a machine. You're trusting the nurse who's standing right in front of you.
And because the doctor on the screen is a woman and the nurse in the room is a woman, it solves that cultural barrier we talked about.
Right.
Women who would never be allowed to travel to a city hospital or see a male doctor can now just walk down the street to this clinic.
And what about the cost? Because usually private healthcare implies expensive.
That's the other barrier they smashed. According to the case study, consultations cost between 50 and 500 Pakistani rupees.
Which translates to, what, in U.S. dollars?
Roughly 50 cents to about $5.
Wow.
It's about a quarter of the price of a private visit. It makes healthcare accessible to people who previously had to choose between seeing a doctor and buying food for the week.
That is incredible. But looking at the timeline in the notes, they didn't stop at just the rural clinics, did they? They expanded.
They did. You see, the rural clinics are high impact, but they're operationally heavy. So to make the business sustainable, they launched a mobile app in 2019 for urban users, people like us who just want convenience.
And the corporate model?
And even more significantly, they launched a corporate model serving over 800 corporations and insurers. That revenue probably helps subsidize the rural mission.
It creates a balanced ecosystem. But really, the massive stress test for this entire system, the moment that proved this wasn't just a nice idea but a necessary one, was 2020.
The pandemic.
COVID-19 changed everything.
It really did. Telemedicine went from being a futuristic option to the only option.
What did the numbers look like for them?
It was an explosion. In 2019, they were doing about 50 consultations a day. In 2020, that jumped to between 700 and 900 a day.
A tenfold increase almost overnight. That's a logistical nightmare and a huge opportunity wrapped in one. How do they handle that kind of load?
They scrambled, but they stepped up. They integrated with the government's Digital Pakistan initiative to offer free consultations. But what's really fascinating here is they didn't just do primary care. They launched a tele-ICU project.
Tele-ICU. That sounds intense. You're talking about intensive care units.
It is intense. The problem was that rural hospitals had COVID patients, but they didn't have intensivists, doctors who specialize in critical care and ventilators.
Ah, okay.
So Sehat Kahani connected top-tier critical care specialists in major cities to about 60 or 80 ICU wards across the country.
So you have a specialist in Karachi basically looking over the shoulder of a doctor in a remote hospital, helping keep patients alive.
Precisely. They were guiding the on-ground staff on ventilator settings, drug protocols, emergency management. It saved lives that otherwise would have been lost due to a lack of specialized knowledge.
That's moving the needle from convenience to critical infrastructure. And if we look at the cumulative impact by 2023, the numbers are just staggering.
Over 2.6 million consultations provided.
A network of over 7,500 healthcare professionals.
And remember, 90% of those professionals are women. They're putting money and agency back into the hands of that doctor bride demographic.
2.6 million lives touched. And, we can talk about millions all day, but there was one story in the notes that really stuck with me. The story of Shagufta from Balochistan.
Ah, yes. That story really grounds the phygital concept in reality.
So Shagufta is a 19-year-old expectant mother living in Khurram, and Khurram is remote. She was terrified of childbirth because historically in her village, if there were complications, there was no doctor.
Women died. It was just a fact of life.
A very real, terrifying fear. But because Sehat Kahani set up a teleclinic there, she was able to connect with a gynecologist. She got prenatal care. And she said it gave her confidence. She wasn't scared anymore.
That is the difference between healthcare being a luxury and healthcare being a right. It changes the entire psychology of a community.
It really does. But I want to be careful here. I don't want to paint this as a completely smooth, magical journey. Reading through the challenges section, frankly, I'm surprised they pulled it off.
The obstacles were massive, and the biggest hurdle initially wasn't technology, it was trust.
The doctor real problem.
Exactly. In rural areas, people simply didn't believe a doctor on a screen was real. There was skepticism, and, let's be honest, there was sexism. There were comments about immature women running these clinics.
So how do you fight that? You can't just put up a billboard saying, trust us.
No. You need social proof. So Sehat Kahani used what we might call a male ally solution. They realized they couldn't bypass the gatekeepers. They had to win them over.
So they went to the elders.
They engaged local religious leaders, imams, and male community elders. If the imam says it's okay, the community listens.
That's essential strategy.
They had these male leaders endorse the clinics. They had male representatives speak to husbands and fathers to explain that this was a safe, private space for their wives and daughters. They worked with the culture, not against it.
And speaking of privacy, that was another massive hurdle, the fear of being recorded.
Huge issue. In conservative communities, the idea of a woman being on a video call, there was a genuine fear she was being filmed or that the footage would end up online.
Which, to be fair, is a valid fear in the digital age anywhere.
Absolutely. So they implemented strict privacy protocols. They made it clear the video feeds are never recorded. It's strictly a live stream. And the physical rooms in the clinics are completely private.
Okay, so trust, privacy, and then there's the infrastructure. Pakistan isn't exactly known for having a perfect power grid.
Load shedding, rolling blackouts is a daily reality.
So what do you do when the lights go out in the middle of a diagnosis?
You build redundancies. They couldn't rely on the grid, so they installed UPS power backups. For internet, they had multiple connections, DSL lines plus 3G or 4G dongles as backups.
And they even built an offline mode into the app.
Yeah, a store and forward system. If the connection drops, the nurse can still input data, and the app saves it. As soon as the signal returns, it syncs. You don't wait for perfect conditions. You build for the conditions you actually have.
There was one other challenge that I found really interesting from a business perspective, the COVID myth.
Oh, right. The investor skepticism.
Yeah. A lot of investors looked at telemedicine numbers during the pandemic and said, this is a bubble. Once COVID is over, everyone will go back to in-person doctors.
And to be fair, look at what happened to a lot of tech companies post-pandemic. The market corrected.
True. But healthcare access is different from business meetings. Sehat Kahani had to prove long-term viability.
And they did. They showed 5 times growth in their numbers post-COVID. They proved that once people got a taste of accessible, affordable healthcare, they didn't want to go back.
And the money followed the success.
It did. They raised $500,000 in seed funding back in 2018. But the big headline came just recently, in December 2023, the Series A round.
Yes, they closed a $2.7 million Series A round.
Now, for listeners used to have Silicon Valley numbers, $2.7 million might sound small, but in the context of the Pakistani startup ecosystem, this is a very big deal, isn't it?
It is historic. With that round, they became the first all-female-founded Pakistani startup to achieve a Series A.
That is a glass ceiling shattered.
It's huge.
Yeah.
So they have the money now. What are they spending it on? Just more clinics?
More clinics, yes, but they're also doubling down on technology. They're looking at AI.
Of course. Everyone is looking at AI, but how is it actually useful here?
It's very useful for triage. Imagine AI bots that can handle basic questions. I have a fever, what should I do? Which frees up the human doctors for the complex cases. And they're investing in predictive analytics to flag high-risk patients.
That makes sense for efficiency. I also saw something in the roadmap about double-blind telepharmacy. What is that?
That addresses a specific safety issue. Prescription misuse. Or fake meds.
Right.
The double-blind system uses QR codes. The prescription is digital and secure. The patient goes to the pharmacy, shows the code. The pharmacist scans it, and it's verified. It closes the loop.
So they're building a pretty sophisticated ecosystem. It's not just a video chat anymore.
No, it's a full medical system. And that connects to their future strategy. They aren't just thinking about scaling up, they're thinking about scaling out.
Scaling out meaning
Yeah.
going global.
Exactly. The problems Sehat Kahani solves, the doctor bride phenomenon, the rural healthcare gap, these aren't unique to Pakistan. You see similar issues in the Middle East, in parts of Africa.
That makes total sense. If this model works in rural Sindh, why wouldn't it work in rural Egypt or Nigeria?
That's the bet they're making. And domestically, they're looking at integrating with the national health insurance.
That would be a game changer. If the government pays for the consults, that removes the cost barrier entirely.
It moves them toward a hybrid health system. Imagine government clinics powered by Sehat Kahani's private network of doctors. It maximizes the resources that already exist.
You know, looking at this whole picture, the image I keep getting is that of a bridge.
It really is. That is a perfect analogy.
It's a bridge between two marginalized groups. On one side, you have these highly educated, capable women who've been sidelined by society. On the other, you have patients who've been ignored by the infrastructure. And Sehat Kahani just connects them.
It connects them and solves both problems simultaneously. It turns a wasted resource into a lifeline. And it proves that technology, when applied with cultural sensitivity, can actually fix structural inequality.
It is inspiring stuff. We've covered the origin, the tech, the challenges, the financials, and the future. But before we sign off, I know you always have something for us to chew on.
I do. When we look at Sehat Kahani, we see technology unlocking a specific dormant workforce female doctors in Pakistan. But this raises a broader question for all of us, no matter where we live. What other dormant workforces are out there hiding in plain sight? In every economy, in every country, there are groups of people with skills and talent who are sidelined, maybe due to geography, disability, childcare duties, or cultural barriers.
That's a great point. We usually talk about the skills gap, that we don't have enough talent, but maybe it's actually an access gap.
Exactly. The talent is there, we just can't reach it. If a digital platform can reconnect thousands of doctors in Pakistan to the economy and save lives in the process, what other invisible barriers could technology break down? Who else is waiting for their Sehat Kahani moment to reconnect them to the world?
Something to think about. That's it for this deep dive. Thanks for listening, and we'll catch you on the next one.
Thank you for listening to Mission Possible, innovating for the world's most marginalized. This podcast is built on the outstanding work of our students, whose curiosity and commitment drive much of the research and storytelling you hear. Each episode is grounded in academic research and shaped through close collaboration with our partners. To learn more about the research and partnerships behind this podcast, feel free to contact us. Thank you for joining.